Hello, this is Dr. Garima, one of the doctors in the antenatal clinic. May I know your name and age, please? Yes, it is Mrs. Mary Joseph, and I'm 30 years old. And how should I call you? Mary should be fine. Okay, Mary. So I can see from the notes that you have done a scan report and you've come here to discuss about that. Is that right? Yes, doctor. So yesterday I got the scan done, and the sonologist had certain concerns about the scan report. So he had sent me to you. Surely, I'll be discussing about the scan report. But before that, is it okay if I ask you a few questions so that we can formulate a safe and mutually agreed management plan? Okay. Can you tell me more about your pregnancy? So this is my first pregnancy. I'm 19 weeks into my pregnancy, and everything as of now has been fine. Okay. And what about the booking bloods and scans? Everything was fine, doctor. The Down syndrome screening, yes, it was done. It was also okay. Are you currently on any medications? No, doctor. Okay. And did you take folic acid in the first 3 months? Yes, I was on folic acid. Okay, and have you named your baby? Yes, it is Lisa. Nice name. Are you able to feel Lisa kicking? Yes, I can feel that. At present, do you have any pain in the tummy or down below? No, doctor. Any bleeding? No, doctor. Vomiting? No, doctor. Any history of fever or flu-like illness or rashes previously? No, doctor. Any history of bleeding prior in this pregnancy? No. Any genetic diseases that you know of? No, doctor. Okay. Any medical illness for which you are seeing the GP? No, doctor. Any surgeries in the past? No. Don't mind me asking, but do you smoke, consume alcohol, take recreational drugs? Have you been regular with your smears? How has been the support at home? Um, any can you tell me if there is any significant family history of concern? No, doctor. Any genetic disorder in your family? uh, yeah, my brother has cystic fibrosis for which he is receiving treatment. Okay, I'll put that in my notes. Okay, so is there any what's your blood group? It is B positive. Weight height ratio, it is 26. Okay. So, thank you for all the information that you've shared. Is there anything else that you want to add? No, doctor. Okay. So, I would like to examine you in the presence of chaperone. With your consent, I would like to check your blood pressure, your heart rate, and your tummy for the baby's growth and the heart rate. Is that fine? Yeah. Okay. So, now coming to your scan report. Uh, Mary, has anybody discussed with you about the scan report? No, doctor. I'm not aware. Can you please tell me what is in the report? Yeah, Mary. I can see that you are alone. Do you want to call somebody to be with you? Because I'll be sharing a lot of information. No, doctor. Is there anything serious? Uh, well, Mary, yes. I have certain concerning news for you. The sonographer, they have done the scan, and they have found that the baby's weight is fine, and also the fluid around the baby is fine, and the they had certain concerns with the baby's bowel being little brighter than usual. So in medical terms, we call it echogenic bowel. Have you heard about it? No, doctor. Is it anything serious? Well, Mary, I understand your concerns. Surely, I would let you know what it is and how it occurs. So basically, it is an uncommon finding seen in less than 1 in 100 pregnancies, and mostly it is an isolated finding where the baby is mostly normal. However, in some cases, it can result in certain complications like the baby being small, and in very rare cases, like in less than 3 in 100, it loss of the baby. I don't want to scare you, but I want you to know everything about the condition. Uh, okay, why did this happen to me? Did I do anything wrong? No, Mary. It is nothing that you have done or you have not done that has resulted in this. So, echogenic bowel, it is an uncommon condition, and it can occur because of several reasons. So, as I told, mostly it can occur as an isolated finding where usually the baby is absolutely fine. In or the other reason could be, it could be because the baby would have swallowed some blood if there was some internal bleeding in the womb, which was very minimal to be uh, expressed outside, or if there is any infection by the viral bug like cytomegalovirus, that can also result in it. And also sometimes if the baby has certain genetic conditions like your brother had, like cystic fibrosis, so that can also result in it. The other reasons for this occurring could be because of it has been associated with genetic problems like Down syndrome, and also sometimes if the afterbirth is insufficient to supply blood supply to the bowel, again it can result in it. So what has to be done now? Um Yes, Mary. So, in order to manage all these risks and complications, from now on, your care will be under group of doctors, which will include the consultant gynecologist, the specialist doctors called fetal medicine specialists who look after the babies who have some problem, the baby doctor, genetic doctor, scan doctor, specialist midwife, and specialist nurse, and also counselors to support you. Is that fine, Mary? Yes. And the basic management will depend upon the cause. So we would need to do some further evaluation, like we would like to send some blood investigations to uh, check for these infections like viral infections like CMV, and also genetic testing for cystic fibrosis. And in case it comes out to be positive in you, you might need to test your partner because the baby receives genes from both the parents. And if both both of you come out to be positive for cystic fibrosis, then we might need to do certain test. We call it needle test, also called as amniocentesis. Have you heard about it? No, doctor, what is it? So basically, it is a test in which a small thin needle is passed through your tummy, and it is done by an expert doctor under scan guidance, where the fluid around the baby, which contains some cells of the baby, uh, is taken, is aspirated out using that needle, and it is sent for further evaluation to check for any genetic problems like cystic fibrosis, Down syndrome, or infections. Mostly, this is quite safe, except in very rare cases, like in less than 2 in 100 cases, it is associated with loss of the baby, or sometimes it can be associated with infection or minor bleeding. Am I clear so far? Okay, doctor. Also, the specialist doctors, the fetal medicine specialist, will be doing the detailed anomaly scan for you to rule out any other abnormalities in the baby. Am I clear so far? Yes, doctor. Also, since your baby is at a risk of being small, so your care will be under consultant-led unit, where we will be doing serial growth scans for your baby at an interval of 3 to 4 weeks to look for the growth, and in case everything goes fine, then mostly the delivery will be at full term, like after you cross 30, 38, 39 weeks, and it will be a vaginal delivery. However, we'll be monitoring you in the hospital, and your delivery will also be in the hospital, and and we will ensure that the baby doctor is around to take care of the baby, so that in case if they require, they would also do some genetic test using the heel prick blood of the baby. Am I clear so far? Okay. And after delivery, we will follow the normal protocol. If everything goes fine, we will encourage you to breastfeed. We'll send you to contraceptive clinic to meet your birth spacing needs. I think so. This was about the management, and any questions that you want to ask? No, doctor. Okay, so coming to today, I think I've given you a lot of information. So this is a patient information leaflet. You can go through it once. I'll also connect you to the support groups, uh, and I'll book an appointment for you with the consultant, with the fetal medicine specialist, and also with the genetic doctor and counselors with your permission. I'll also be writing back to your GP, and is there anything else that you want me to address? No, doctor, that's all. Thank you so much for your time.